speaker. It's Dr. Ramirez. He has a long list of accomplishments, and I'm not going to go through all of them, but he's the co-founder, and chairperson for the High Alert Institute, which is a nonprofit corporation. And he'll talk about some interesting stuff that he's working on and putting a group together. Maurice, please expand your introduction and take it away. The stage is yours.
Well, thank you. And welcome, ladies and gentlemen. This is my second opportunity to present with InnovatorMD. And I'm going to depart from our originally scheduled presentation this evening for two reasons. The first is Yuli's introduction. It leads into a project that the Institute has been involved in for 2 years and first presented at InnovatorMD 2 years ago. The second is that a number of you who introduced yourselves, I'm hoping, will take an interest in joining our working group. So today I'm going to talk with you about AI-based, decentralized, interglobal, which is space code for interplanetary, medical expert systems. This is a concept that was originally brought forth by Katzenwong in 2017 to use AI medicine and AI systems to first depersonalize or anonymize medical records, Eric, and then to analyze those records against all diagnoses, all treatment plans, outcomes, side effects, and adverse events. That's level one. At level two, Katzenberg posited to then compare across providers the same data so that we had now not only an idea of how well individual patients do given their demographics, their omics, their phonetics, but as well all of the treatments and the variations in treatment styles and combinations of diseases and other findings. And then we have at level two the same information with the physician across physicians worldwide. At level three, we bring in social determinants of health, social media, those things that are environmental but local to the individual patient groups, building a progressively larger database of information from which the AI at a machine learning level would then be able to make predictive models to assist providers in the future with adequate diagnosis and most appropriate, also most patient accepted treatments. At level four, we bring in guardrailed analysis of the scientific literature and outcome databases from regulatory agencies. How did we do, and how do diagnoses and treatments do in controlled circumstances? And how does that compare to the real world evidence from real patients in the wild? Katzenwong then posited at level five that these systems would then become instructive and assistive to healthcare providers. And at level six, he posited that they could even, in emergency circumstances, austere environments, perhaps disasters or healthcare shortages, initiate diagnosis, initiate testing, and even initiate treatment. Sounds like science fiction, doesn't it? Well, Katzenwong's article wasn't very well received, even though it was published in the Journal of Cardiology 2017. Unbeknownst to Katzenwong, the 22 international space agencies at the time were planning a return to the moon as a stepping stone to Mars. We now know this as the Artemis Accords and the Artemis Project, after the successful launch of the first Artemis unmanned mission, which started a time clock for the international space agencies worldwide for a return to the moon and permanent moon habitation in the next 5 years. In support of that, the 22 agencies met in 2018 and published in 2019 a white paper known internally as the XMC. We call it the XMC, spelled E little XMC, because, no joke, The title is 28 words long. Typical space agency titling. The XMC defined 5 levels of healthcare that would be required of both government-sponsored space missions and, more importantly, private space industry to be licensed to fly to get to space. Now, here's the trick. If you want to fly in space starting on Earth, you've got to first fly inside our atmosphere, which means that you are now a regulated industry, even though by international treaty, no government can extend its authority greater than 90 miles above the Earth's surface. So they can place any requirements they have that they wish on you, because you can't fly the first 89 miles to get your crew up there without meeting the requirements, without meeting the regulations. And these guidance documents that are published, known as operational guidelines, effectively become the regulatory guidelines. They define the market for the equipment, the safety equipment that must be present on every private industry aircraft and spacecraft in order for it to go to space. Now, space will be a $1 trillion per year per habitat market. Going to the moon to mine deuterium, tritium, you can expect to make $1 trillion in revenue per year. Going to Mars to mine or to colonize, $1 trillion minimum. That's the forecast. And there is no end to the burn on that. And nobody's been able to calculate a CAGR because we don't know how much that will advance society and economies here on Earth. But to go, you have to meet the XMC. The XMC in the first 4 levels basically defined healthcare as it's practiced here on Earth in rural communities. You have acute care, emergency room care, urgent care, center care. You have basic family practice, geriatrics, obstetrics, and pediatrics for acute and chronic illnesses. And you have major trauma, catastrophe, space disaster, if you will, at the first 4 levels. But level 5 became the interesting piece, because on the moon, if your healthcare team dies, you have a catastrophic event that kills all of your healthcare team, on the moon, you can use telemed because the latency for communication is at most 38 seconds. So you can use telemed and train Scotty the engineer, or one of those security guys who wears the red shirts on Star Trek and always dies before the end of the episode. You can use one of them as a stand-in healthcare provider by telemed on the moon. Mars, on the other hand, is a problem. The 2-way latency for communications is 38 minutes. Telemed is not going to work. Add to this the fact that every Earth year, there are several 2-day blackout periods because of the relative position of the celestial bodies. And every Mars year, there is a 2-week blackout period. So on Mars, telemed is not an option. Worse, the best transit time from Earth to the moon to pick up an interplanetary vessel, and then from the moon to Mars, and then from Mars orbit to descent is 414 days. That assumes that you have a crew trained and ready to go on Earth. You have an Earthbound launch vessel to take them to the moon. You have an interplanetary vessel in orbit and fueled around the moon to receive this team, and that is not dedicated to another mission or can be rededicated to this mission, and that nothing goes wrong for the next 410 days after you leave the moon until you get to Mars and descend to the planet's surface. Something always goes wrong in spaceflight. But you have to deal with 414-day minimum to get a new healthcare team to the moon, or excuse me, to Mars, if your team is killed. This means that for 414 days, you must handle all 5 levels of care under the XMC, and do so with people who are not trained when they arrived on the moon in anything other than first aid and emergency care. Effectively, non-life sciences individuals. The solution of the 22 agencies, they decided that what was needed was an AI-based system that could, again, autonomously diagnose, test, image, interpret, and treat patients and provide the necessary education in the moment during high-stress events to non-healthcare personnel to save lives and provide ongoing care, rehabilitation, and the full spectrum of healthcare for greater than 414 days. And oh, by the way, part of this new market, this new device, this new ecosystem of software that will be required for industrial private space flight will have to be ready in time to have the first habitats on Mars no more than 12 years from now, 2032. Now that sounds pretty good, but we have to back that up 2 years to get to Mars. So now we have to have it ready to launch in 2032. 2034, now we're back to 2032. But wait, we also have to back that up because any system flying has to be tested in an analog lab here on Earth. It has to be locked in a duplicate habitat here for the same service time we expect it to operate on Mars. And we have to make sure that it actually can operate here on Earth successfully without a glitch for that entire 414-day service time. So back up another 2 years, now it's 2030. And of course, we're going to go through more than one iteration of the software. So let's put in a typical NASA safety period of another 4-year backup. 2026 means the alpha test version of this needs to be ready by 2026. Ladies and gentlemen, it's 2023. The High Alert Institute learned about this in 2021 and formed a working group among AI companies, blockchain experts, because we needed to be able to deal with privacy here on Earth, and medical experts in artificial intelligence. And we began a working group to just examine, is this even a possibility to sketch out an ecosystem? We're not looking to write the algorithms or borrow other people's technologies. We wanted to create an image of what this would need to look like, what capabilities it would need to have, so that the entire industry could then move in that direction in unison. Because I'm willing to guess that out of the 40 participants in this conference, there are only 5 who knew that this marketplace existed before 10 minutes ago. We refer to this organization as this working group as AI Dimes, the abbreviation for the decentralized system. We have a rough a rough diagram of the components for all 6 levels. And we've addressed some of the issues of privacy and data boundaries here on Earth in order to be able to exchange that information using machine learning, federated learning, and swarm learning. Our next steps over the next 18 to 24 months for the working group is to address and diagram all or as many as we can anticipate of the other components that would be necessary for a system as envisioned by the 22 space agencies and embodied in the XMC document to be developed, and then to publish this in a white paper, open source to the industry, so that the industry can attack this. Because if you don't have it, you don't fly, which means that the price tag is pretty much whatever each person, each company in the ecosystem of software chooses to charge for it. Now, imagine, if you will, it's 2032.
1 minute to go, Morris.
And in 2032, the first human is saved in space by an AI digital provider without human intervention. Everyone on Earth will demand such a system because it immediately solves the problem of healthcare inequity and healthcare access. Questions?
Thank you.
Yep.
Thank you. Any questions for Dr. Ramirez from the audience?
Did he say AI dimes or times?
DIMES, as in decentralized interplanetary medical expert system.
That's what I thought you said. Thank you.
No problem. It's government loves acronyms.